Dupuytren's contracture is called the Viking's disease. If you have roots in Western Europe, you could possibly see some issues with your hands at some point. What it is there's these bands that wrap themselves around the tendons in the fingers. And what they do, those bands will start to pull down on the tendons, and what will happen is the finger will actually pull down like that, and you cannot push it back up. And so it's very uncomfortable. John Elway of the Denver Broncos had it. It affected his game. It affected his passing. He had an injection done, and I'm going to talk about that in a minute because I've had both. I've had an injection and surgery. So one of the things that I want to make very, very clear right now, if you find that you're getting this problem, and you'll have to go to a hand specialist to determine if it's Dupuytren. If you find that's coming on, then you want to get to it right away, because if you wait too long, the surgery can be very difficult. You lose a lot of mobility in your hand if you don't get to it as quickly as possible. So let me go over a few things for you. What will happen is you can see in the hands, and I'm going to show you pictures of these. Maybe we can put those pictures up now. Of what the fingers look like when your bands are circulating around the tendons. And what happens is you can see the fingers being pulled down. Now it looks like you should be able to the muscles in your hand should be able to straighten them back up again, but that's not the case here. What's happening is they're pulled down and there is no way to get them back. It is a solid rejection of the ability to move it back into its normal position. What I did was I had the injection, and it's called Xyloflex. There's probably other ones out there, but Xyloflex is very common or well known, and that's the one that John Elway had, as a matter of fact. And you actually put in the injection into the fingers, and then what happens is it breaks up those bands, and then you just, over a period of 24 to 48 hours, you go back in and you straighten out the fingers, and it snaps those bands. So that works for about a year. I mean, in my case, about a year. I had it done on several fingers, and I think I got a year, maybe a year and a half before I had to look at doing it again. So I went to another hand specialist, and he's done injections quite a bit with Xyloflex, and his comment was it doesn't last very long at all. So he wanted me to have surgery. So what I did is I had the surgery, and let me just show you. This is my hand. After the surgery, this is what it looks like. Now you're going to say, how come I don't straighten out my hand? Because that doesn't go back any further. I know it's kind of embarrassing to show you this, but that's what my hand looks like right now. I can bend it down pretty good. You can see this finger right here doesn't go down all the way. These go down pretty good, but I play a lot of racket sports, and it's nice because I can grip the racket again. And but for people who maybe play guitar or piano or something like that, it's very hard. So the surgery was something I did next. Now I'm going to show you some pictures here now of what the surgery looked like afterward. So just be forewarned, these are pretty graphic. So after the surgery, you can see the pictures here. Now, keep in mind that it wasn't so much the surgery. They numb you up, you feel fine, you know. Of course there's a recovery period. My recovery period was probably, before I had reasonable function, was probably 3 to 4 months. You could do things, you know, with after the surgery, but it took that long before I could put a racket really back in my hand again. But here's the thing, it's the physical therapy that'll kill you. They bend your fingers and they work your fingers so that you're going back to those normal positions, and it's a real challenge. So the question is, what is the best way to do it? Is it the Xyloflex, or is it the or is it the surgery? Now I want to show you something. This is my other hand, so I had it on both hands. And by the way, before I show you this, I just want you to know that Dupuytren is not only on the hands, but it can also be on the bottoms of the feet. And it also can affect in some men in the genital area. So that would be an unfortunate thing if you had that, but Dupuytren is throughout the body, and it goes on the bands around the tendons. So here's what my finger looks like after surgery. I'm going to see if I can do this so you can see it. You can see, first of all, I'll show you my hand. Okay, so there it is. Here, look at this. This finger right here goes bends up like that. And the reason is that the surgeon cut right there because he was trying to extend the bands, the tendons, and I don't think he did it properly. Because if he extended it, we would be able to bend this. This is solid as a rock. I can't bend it back down. So it's okay. It's functional. And they did a great job here, and there was a little bit of a correction on that finger. So you can see it bends down pretty good, and it straightens up relatively well. But, and you can see the scars from it. Look at all the scars, if you can see closely on both hands. Put that up there so you can see both hands. There's quite a bit of scarring that goes on. If you're going to choose to do surgery, just know that you'll probably get more time before it starts to come back again. Because I'm going to guess with Dupuytren, just based on how how this works, it's coming back. I mean, I got no choice. They're going to wrap around the bands again, and it's going to start pulling my fingers out. I'm going to have surgery again. I'm not looking forward to it. I'll probably do the Xyloflex the second time. Now, it's going to require a lot more shots because you think about it, if the bands are around the tendons and you break it in one spot, all that has to happen is those bands have to reconnect again before it starts pulling. So if you've broken it up in a couple, 3 different spots, and what it is it's the collagenase that you're injecting because you're trying to break up the collagen, if I got that right. And so if it's only broken up in one spot, again, it's going to start regenerating, start pulling on your fingers. So I'm going back to Xyloflex again. It's about a tenth, probably about an eighth of the cost, and so I'm going to try that see if I can get some relief out of it for about a year or 2 and see what happens. But see, I showed you this part of the finger, but right here, somehow he missed this. You probably can't see this, but in this finger right here, there is some of the tendons that right there that you can still see that has problems. And so and you can see down here possibly, I don't know how good the focus is, but if we break that up, it'll probably be able to bend this finger so that it's straight here, but it'll still have this tip that'll tip back like that. So it's crazy. It's not a winning proposition for anybody that has it. So I hope that helped you. If you have any comments or questions, put them in the down in the description area, and we'll see if we can help you. I would try the Xyloflex first, quite frankly. And if there's also with Xyloflex, you can get a grant, like you just call them up, and there's some type of money that's available to you to use the injections, and it'll save you a little bit, but it's still going to cost you probably $3,000 per injection, something like that. I don't remember what it was, but it's pretty high. So I hope you enjoyed this video. Don't forget to subscribe. I got more coming down the road, and also you want to click that little bell so you get all notified about everything that's coming up in the future. Hope you have a great plasma-rich day, and thanks for joining us.